Hello everyone, welcome to Move Well, Live Well. We've been having a number of people coming in with issues regarding their hip. In particular, pain in the hip, kind of going into the butt, sometimes goes down into the back of the hamstring. You can even go sometimes into the front just a little bit, or it can go all the way down kind of the back of the knee into the calf. And what we're finding with some of these folks is that the reason why they're having that problem is some of the rotator muscles of the hip are in spasm. They're tight, they're taut, and they're cramping up in there due to, let's face it, we all sit way too much. So what's happening is they're cramping up in there, and when you're seated, your hips can't really find a good stabilization point in which to sit properly. So they're always kind of trying to stabilize and trying to find a position to stabilize that hip. Well, anyway, so what's happening is they're cramping in there, and it's causing discomfort and dysfunction through the hip, and they're wondering why they got pain going on the butt, and sometimes it could be misconstrued as sciatica, when a lot of this is just referred pain from the tight cramping muscles and structures within the hip joint itself, the rotating muscles. Kind of like you have a rotator cuff for your shoulder, which help to internally and externally rotate your shoulder. You have muscles in your hip that help to rotate, internal and externally rotate your hip and provide stabilization for the hip. Well, those muscles can cramp up and cause you all kinds of problems. So one easy solution, other than stretching, that you can do is grab a ball. Have a ball, if you will. The ball that we find that is the most useful is Lacrosse Ball. It's a very solid ball in which to do this therapy with. And unlike a racquetball, you can use a racquetball as well, or a handball, but the thing is with a racquetball is sometimes a little mushy and it doesn't quite get in there as well as a racquetball would. A tennis ball is fine too, but again, it's quite mushy, and you can have some problems with that particular issue with the tennis ball because it's mushy. And the thing is with tennis ball, it's kind of got felt in there, so it kind of can slide around. Whereas a lacrosse ball is nice. It's got a grippy surface, rubber surface in which to grip the areas with. Well, anyway, so the idea by using a racquetball to do this kind of therapy, sometimes these muscles here in the hip are surrounded by big muscles, like the glute maximus is one of the biggest muscles in the body that surrounds that. But to get deep into those rotating muscles of the hip, you got to use something like this to really get in there and stretch those out. So this type of therapy, if you think about my hand or my fingers here, I don't know if you can see this. I'm gonna put the ball right here. The reason why we use a ball like this, imagine my fingers are kind of like the muscle tissue itself. And when we push with the ball, you can kind of see how my fingers bend around the ball, and the area in which the ball is pushing into stretches that particular area. So same thing here. My hands or fingers are muscle tissue. You can see as I push with the ball, the muscle will start curving around it and starting to stretch. And you can kind of go back and forth and floss back and forth, side to side, to really get into those deep muscles of the hip. So anyway, you just take a ball just like this. What I like to do, see it here, it's typically, if you feel that bony protrusion in the side of your femur right there, that's the greater trochanter. Just up from that, below your kind of belt line, if you will, right in here, that's the glute medius. You can kind of lay on your side just like this, and move my shirt out of the way here. There we go. You can kind of sit into that and let that sink right there. And you just kind of slide around a little bit and search for that spot, like right there for me. Just by laying back just a little bit, I'm using my elbow here for support. Just by laying back on that, woo-wee, I can feel that tenderness in that glute medius, one of the rotator muscles of the hip. And I can feel it go into my butt. Sometimes I can kind of feel it. I don't have too many issues that cause me sciatic or referred pain down the leg. But this particular treatment right here, I do on occasion just to keep my rotator muscles of my hip functioning properly. Because yeah, like I said, we do sit a lot, and even me, I do sit a lot, even though I'm up and moving around most of the day, and I try to get some exercise in. But yeah, so right in there, I can really feel that. And take some good breaths. Remember, this is a stretching mobilization type of exercise. You want to get that muscle, those muscles within there to relax. So you're taking good deep breaths. And again, we're not breathing from the chest, we're breathing in through the belly. So let that belly kind of hang out. There goes. And then you'll find the pain and the discomfort in this area will kind of dissipate. And then you just hunt and search for another spot and hang out in there. Right there, there's another spot right there. Again, hang out in there. So this shouldn't take you too long, 2 to 3 minutes, you know, half a minute to a minute in each spot until you feel that pain kind of dissipate. And then you can even push a little harder if you want. You can let your body sink down into it more, and then you really feel that sucker light up. And you may even feel it all the way go down the back of your hamstring into the calf or into the butt. So right there. And then you switch both sides. You'll find that one side is more tender than another, simply because, you know, we as humans are either right hand or left hand dominant. We have a tendency to use one side versus another. So great tool, great easy way to provide a mobilization or stretch within these tight cramping muscles of the rotators of the hip. And like I said before, what it does, it provides a stretch that we sometimes can't quite get to with regular stretches, but this really gets into those small muscles. And if you imagine my fingers as a muscle, you can kind of see as I push in to that muscle that the ball will stretch, the muscle fibers will curve around that ball, creating that stretch of the ball, of the muscles. So, if you have any questions, feel free to drop them off in the comments section below. We thank you for watching. We appreciate it. Please like, subscribe, and share. Subscribe so that way you don't miss any videos. We try to update these videos a few times a week to give you education as for some of the conditions you may be experiencing. Once again, we thank you for watching. We'll see you next time. Take care. Bye-bye.